All right, thanks. In an effort to keep you updated here on healthcare reform as the changes are rolled into effect, our insurance expert Craig Gusson joins us again this morning talking about Medicare today.
Yeah.
That affects how many people, do you think, in California?
You know, I don't know the exact number, but anybody who's 65 or older, and statistics I see is that every 10 minutes somebody in the United States turns age 65.
Okay, so this is a big deal for a huge segment of the population.
A very big deal.
These are changes to the way the system currently operates?
Well, between October 15th and December 7th, it's what they call open enrollment for Medicare. So if you have a Medicare plan, Part D, which is the drugs, you can change your prescription. The best example I always use is somebody is on Part D, they're 65 right now, and all of a sudden their medication changes, and they need to take a more expensive medication. They can change the prescription plan to cover more benefits, you know, between October 15th, December 7th. It'll go into effect January 1, and it'll give them more benefits on that. So changes you can make, and just be aware of it.
But I was looking at how many different options there were on Medicare here. Yeah. What is it, like a dozen options?
There's 10.
10, okay.
A through, I think it's A through M. And Plan F is the one that we normally recommend to all our clients because Plan F covers everything. It's a plan we've been recommending and selling to our clients for years. You're going to have no copay for doctor visits. Your medical expenses up to Medicare reimbursements paid at 100%. And how it works is very simple. Whatever Medicare doesn't pay for, your plan will pay for. So you don't have any costs out of pocket. So you can either go with one of the 10 plans, or you can go with a Medicare Advantage plan, which a lot of people, the best way to compare it is like an HMO type plan. So you have some options of what you want to do. If you have a Medicare Advantage plan and you want to change that plan, you can also do it through open enrollment. It's just, this is the time of year that you want to do it. And, you know, unfortunately, it's also the same time of year that everybody's talking about healthcare reform. So you have all this going on at once, and the best thing to do to get educated is to talk to your agent and have them walk you through what options you have. Because when you turn 65, many years from
now, forever.
You're going to get all these different books and pamphlets on all the things you can do, and every one of my clients will call me up and says, oh, what is this? And then we walk them through it and say, what are your needs? We sit down, we talk about your needs, we come up with a plan of what's going to work for you. We look at your prescriptions, figure out what prescription plan out there is best for you. So you have Part A, which the government pays for at 100%. You have Part B, which is $104.90. It comes out of your Social Security check. And then you have Part D, which is your drugs. So you really want to just be aware of it. And again, if you're making a lot of money, that $104.90 that you pay for Part B could go up to $336.
Okay, so that's significant as well.
That's where they get the money back.
Before I let you go quickly, the numbers came out on the fines for those people that don't have insurance, that don't choose to buy insurance. Now, the first year, it looks kind of like a no-brainer. It's like $95 or 1% of your income.
Exactly.
So the first year, if you don't feel like buying it, well, just pay the $95, and then if you need insurance, they can't deny you, then you buy it then.
Well, no, because if you don't buy health insurance by April 1st, 2014, you cannot buy it in the United States of America until January 1st, 2015. The only exception is if you lose your job and you lose your health insurance, you get divorced and you lose your health insurance, you can then apply and either go on COBRA or get individual coverage, or if you go to work for a company and they offer health insurance, you can come on it. But come April 1st, 2014, nobody in America can go out and buy an individual health insurance plan at all. And that's one of the big things why, yeah, you want to pay the $95 fine, that's fine. But if you're hospitalized, how are you going to pay that bill? The numbers that you're talking about have been out there for 3-4 years. Now I guess they're just confirming those are the exact numbers.
Okay. Craig Gusson, our insurance expert, will talk to you again in the next week or so as more info continues to roll out.
Take care.
Thanks, Craig.